Acute bacterial prostatitis is a sudden and serious infection of the prostate that often happens alongside a lower urinary tract infection and can make a man very unwell with signs of sepsis. When this happens, doctors must also look for and treat the underlying cause that allowed the infection to start, such as blockage to urine flow, narrowing of the urethra, problems with bladder emptying, or urinary stones. Certain situations make this infection more likely. These include having a recent urine infection, inflammation of the epididymis, a long-term urinary catheter, recent prostate or bladder surgery, urine flowing backward into the prostate ducts, a tight foreskin, or stones within the prostate. These factors allow bacteria to enter and settle in the prostate more easily. The illness usually starts suddenly. Men often develop high fever, chills, nausea, and vomiting. Pain is common and can be felt between the legs, above the pubic bone, in the penis, groin, or external genital area. Urinary symptoms are mixed and may include needing to pass urine frequently or urgently, pain when urinating, difficulty starting the stream, a weak or stop-start flow, or even complete inability to pass urine. Some men show signs of severe infection, such as a fast heart rate and low blood pressure. On examination, the bladder may be swollen if urine is trapped. An rectal examination often reveals a swollen and very tender prostate, although it can sometimes feel normal. Tests usually include blood tests to look for infection and inflammation, urine tests to identify bacteria, and sometimes blood cultures if the patient is very unwell. Swabs may be taken if a sexually transmitted infection is suspected, and bladder scans are used to check how much urine is left after voiding. Prostate massage must not be done in this condition because it can worsen the infection. Treatment depends on how ill the patient is. If there are signs of sepsis, urgent resuscitation and emergency treatment are started straight away. Antibiotics are essential. Men who are otherwise stable can usually be treated with strong oral antibiotics, while those who are very unwell need intravenous antibiotics in hospital. Once the infection improves, treatment is switched to tablets and continued for several weeks to ensure the bacteria are fully cleared. Pain relief is also important. If urine retention occurs, a catheter may be needed to drain the bladder. One serious complication is the formation of a prostatic abscess, which is a pocket of pus inside the prostate. This is suspected if fever and symptoms do not improve despite appropriate antibiotics. It is more common in men with diabetes, weak immune systems, kidney failure, or those who have had catheters or recent procedures. Examination may reveal a soft, boggy area in the prostate, and scans such as ultrasound, CT, or MRI are used to confirm the diagnosis. Small abscesses may be treated with antibiotics alone, but larger ones usually need drainage, either with a needle or surgery. Chronic bacterial prostatitis is diagnosed when bacterial infection and symptoms last for 3 months or more. It is usually due to repeated or persistent infection. Men may experience ongoing pelvic pain, urinary problems, and difficulties related to ejaculation. Assessment focuses on identifying contributing factors such as long-standing urinary symptoms, kidney or bladder stones, or bowel conditions that could allow bacteria to enter the urinary tract. Investigations include urine and semen tests, special urine cultures to localize the infection to the prostate, tests to rule out sexually transmitted infections, and measurements of urine flow and bladder emptying. Questionnaires are often used to assess symptom severity and impact on quality of life. Treatment involves a long course of antibiotics that can penetrate the prostate well. The response is reviewed after a few weeks, and treatment may be continued for up to 6 weeks if improvement is seen. Patients are warned about possible long-term side effects of certain antibiotics. Medications that relax the muscles of the prostate and bladder neck are also commonly used, as they improve urine flow and reduce pressure and reflux within the prostate.